Assalamualaikum warahmatullahi wabarakatuh and a very good day everyone. I am Ahmad Aziff Ashraf bin Nur Azam, students from School of Mechanical Engineering UITM Shah Alam. Today, I will be presenting my final year project proposal. The title for my project is Post-Operative Device for Patient Following Removal of Impacted Third Molar Surgery. First of all, I would like to thanks to my supervisor, Associate Professor T.S. Dr. Zulkifli Muhammad and Dr. Azli Mazili Anwar for the guidance throughout this project. First, I will explain the summary of my project. This project proposed a universal ice-pack device for patients following removal of impacted third molar surgery. For your information, third molar is also known as wisdom tooth. The main objective of this project is to design and optimize an ice-pack device that is accepted by the patient, where the patient wanted to use this device, which are comfortable, and the device can help improve their quality of life. In the end of this project, we will be expecting one 3D printed model of an ice-pack device. Next, we will go through the flow for this presentation. We will start with introduction, literature review, problem statement and objective, scope and limitations, methodology, expected result, and we will end with a program planning. Let's start with the introduction of this project. Third molar teeth or wisdom tooth is the third set of molars that are located at the back of the mouth. Wisdom tooth often need to be removed as it erupts in a different way, such as horizontal, mesial, and distal position. This abnormal eruption causes pain to the person experiencing it. The surgery is needed to be done to remove the teeth. Post-operation, patient will experience trauma that causes inflammatory complications such as pain, swelling, trismus, infection, and limitations in mouth opening. Cold therapy, or also known as the cryotherapy, is one of the therapies used to relieve the pain and swelling of the patient. This is the best low-cost therapy that has been introduced to the society. However, the normal ice pack device that has been used is uncomfortable for the patient, as the patients are unable to move freely due to the devices when the patient needs to hold onto the devices to their face continuously for 20 minutes. Hence, this project proposed to design and optimize an ice pack device that can make the patients feel comfortable and increase the recovery rate post-removal of third molar. Next, I will explain the literature review for impacted mandibular third molar. The word impaction comes from the Latin word impact, which refers to an organ or structure that has been stopped from resuming its natural position due to an improper mechanical state. In this case, impacted third molar or impacted wisdom teeth are the teeth that fails to erupt or grows into the proper position, causing pain to the person experiencing it. According to studies, there are various types of mandibular third molar, which are mesioangular, vertical, horizontal, distoangular, transverse, and inverted. The third molar extraction surgery can lead to post-operative problems such as edema, trismus, surgery site infection, and alveolar osteitis. In most cases, wisdom tooth extraction involves damage, which leads to an inflammatory reaction, with pain peaking in the early post-operative period. Next, I will explain the literature review of cryotherapy. After surgical removal of wisdom tooth, dentists frequently recommend cold therapy or cryotherapy. According to studies, cryotherapy can reduce temperature that lead to vasoconstriction, which lower the post-operative edema. It can also have the effect of analgesic. Ice pack is a low-cost option for patients allergic to dexamethasone. Cryotherapy is very effective if it is given on the first day of surgery. The problem found in this project is that the normal ice pack device that has been used have a low effectiveness and also make the patients feel uncomfortable as the patients are unable to move freely due to the device. Therefore, a new iSpec device is needed to improve the recovery rate and also easier for the patient to use. The objective of this project is to design and optimize an iSpec device that have a universal design accepted by the patient and comfortable to be used. The second objective is to produce an iSpec device that have a higher recovery rate as compared to the normal iSpec device to improve the quality of life of the patient. The scope and limitations for this project is it only focusing on one specific area, which is a facial swelling around the cheek. The design of the iSpec should at least cover this area to optimize its function, which is to improve the quality of life of the user. CAD drawing of the iSpec device will be done through CATIA V5 and finite element analysis will be done for this simulation. Next, I will explain the methodology used in this project. First, literature review is done to understand more about the project. It is done through research and reading of article and journal. Next is sketching of the design. After completing sketching the design, CAD design will be drawn using CATIA V5. After completing the improvement of the CAD drawing, few methods will be done to choose one best design to go through the finite element analysis. If the finite element analysis fails, the design will be adjusted again using CATIA V5 and finite element analysis will be done again. And lastly, the design will be 3D printed to be used by the patient. In the end of this project, it is expected that one iSpec device will be produced that has an aesthetic looks and feature which are comfortable to be used and also have a higher effectiveness that can improve the quality of life of the patient. So far, there are 4 designs that has been proposed for this project. However, all of the design is still in revision 1, which there will be an improvement in terms of dimension, sizing, and the design itself. 3 of the design has been drawn in CAD using CATIA V5. However, the final design is still in sketching phase as it is a new design that I proposed to my supervisor. Let's take a look to the revision 1 of the iSpec device. This is the design and blueprint of design 1 of the iSpec device. The idea of the design is taken from a face mask, where it will cover the whole face from ear to ear. There is a hole for nose to breathe, and at the both sides of the device, there will be a slot to put the iSpec gel. The thickness of the device is 2.5 mm. It is light and easy to be used by the patient. This is the design and blueprint of design 2 of an iSpec device. The main part of the design is identical to design 1. However, the hook is only at the top part, which will be attached at the nose. This will make the user more comfortable as there is an opening at the mouth and nose section. This is the third design of the iSpec device. It is similar to design 2, but the hook is at the bottom, which will cover the chin of the user. It is comfortable to use as the hook is adjustable and soft, where the user can still move their chin freely. This is the last design of the iSpec device. The design is still in sketching phase as it is a new design proposed. The idea of the design is taken from an ear-muff design, which an improvement will be made at the side of the model where it can attach and detach the iSpec gel. This is the view chart made to select the best design. Note that design 4 is not included in this section as it is still in sketching phase. After completing the CAD drawing of design 4, view method will be done again to choose the best design. The criteria needed to select the best design are comfortability of the device, the aesthetic looks, user-friendly, which is easy to use by the patient, the cost to produce the product, And lastly, the ease of maintenance, which is the process to clean the device after it has been used. According to this few method, the best design is design 2, where the weightage is 22. This is the Gantt chart for project planning. The green box is the current phase, which the part that I have done, while the yellow box is the planning phase. For any inquiry or questions about this project, you can contact me through my email or my contact number. That is all from me. Thank you.